Good morning, everyone. Hello, 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 and welcome. Welcome to our third installment for 2023's Clinical Associate Student Career Webinar Series. Wow, look at that. We're already on the third one. This year is really, really flying. Thank you so much for everybody who's joined. We're looking forward to seeing those numbers grow. So let everybody know that we've gone live. It's 6 p.m. in South Africa, and everybody else around the world that's joining us, welcome, welcome. My name is Nompumelelo Makakula. I'll be your host for this evening. A warm welcome again to all our students from the 3 different universities, Walter Sisulu, University of Pretoria, and the University of the Witwatersrand. Today, we are going to be having our third monthly webinar, as I had stated, and we are very, very privileged to have 3 clinical associates that will be taking us through their journey in this career that they have forged for themselves. We are all finding out all the beautiful ways we can use our degree and becoming very valuable members of the healthcare system in South Africa. So the aim of the webinar is to have qualified clinical associates come in and share their journey as they navigate different workplaces and new endeavors. As a result, students are encouraged to come and participate so they can gain insight into the postgraduate world and hear it from the horse's mouth. These are the clinical associates that are already practicing. We aim to use this platform to encourage new qualified clinical associates, the student clinical associates. As mentioned, I will be your host for this evening's session. I myself am a clinical associate, and I will be taking you through tonight's webinar. We have 3 very beautiful guests, because it is beautiful women that will be our guests this evening. The first is Mrs. Ronella Razuma. Apologies if I'm not saying that correctly. Ronewa is a Wits graduate who qualified in the year 2019. Ronewa is currently working at Quro Medical and also pursuing postgraduate studies. Ronewa will tell us all about that during her presentation. Our second speaker is Ms. Tidimalo Chavani, also a Wits graduate, who's currently working at the Aurum Institute as a senior program manager. She is passionate about public health and recently completed her honors degree, and she'll tell us how her career is looking thus far. Our third and final speaker will be Ms. Goodness Maluleke, a UP graduate who graduated in the year 2017 and is currently working in the public sector at Mamelodi Regional Hospital in the emergency department. Each speaker will be given 10 to 15 minutes to speak, and then at the end of the third speaker, we will open the floor for questions, but we do encourage you, as the speakers are speaking, to please post your questions in the chat space, and we will open up the question and answer session at the end of all 3 speakers. Tidimalo Chavani, over to you.
Good evening, everybody. As said, my name is Tshidi Chabane, also known, if we were to go by our ID names. My full name is Matshidiso, but I prefer being called Tshidi, short and it's simple. And I'm a clinical associate, and I qualified in 2013. Oh, it's a long time ago. It's 10 years now. And I think in my 3 years of studying at this medical school, I was awarded each year best student. And on the final year, I was also then awarded the Andrew Truscott Memorial Award. I was the third person to get the award, yes. And then so what had happened prior to that is that I was in the South African Military Health Services with the Department of Defense, or the Defense Force rather, and we got funded or received a bursary to study BCMP. And then I studied with WITS. I qualified, and in 2014, of course, I returned to the South African Military Health Services to work in the military clinics. So if you know the Defence Force well, you would know that it is a community within a community, that they have their own clinics and hospitals. So we worked at what we call sick bays. So sick bays are like primary healthcare clinics that are run by professional nurses. And I think for 6 months in 2014, we attended military training, which was called officers. And you can imagine just the frustration after you've just qualified as as a professional, and now you have to go back and just in the military do military things. So I was ready to be in the field, and I mean I was ready, to start providing services. However, we had to follow that and its procedure, and then we went to the military clinics, and there wasn't really much to do for us at the time because the profession was fairly new. So I got so bored, and then I started doing locums with CHEPS. At the time, it was providing VMMCs. And I firstly got trained, and then started providing locum sessions during weekends. And then I thought this is very exciting because then I was from one clinic to the other, so I basically was very eager to work with people and help people. I mean, all sorts of cases that we saw. I mean, even, just not circumcision alone, we got to do HIV testing, we got to do STI treatments as well. So, or STI management rather. So that was really exciting for me. Then I resigned with the military health services, and then I joined CHEPS full time. 3 months after I had joined CHEPS in 2015, I think this was now August, I then was recruited or asked to join the training team that was training the entire South Africa on voluntary male medical circumcisions. I joined the team, and 3 months after joining the training team, then I was promoted to being a project manager there. So I was still circumcising as a surgeon, and then I also joined the training team, and then I was a project manager as well. So I had 3 roles. I felt CHEPS understood me, and they understood that I was like a go-getter and I wanted to be challenged. So they gave me as much challenges as I needed to stay there. And as a project manager as well, then I stopped the clinical work at the time to manage a couple of clinics. Was in Gauteng, in Northwest, and in Free State as well. So there was a couple of clinics in different districts in the provinces that I had mentioned. And then I went ahead and also took over the general practitioners QA, so or mentorship rather. So we would train the GPs, right? And then I would have to follow up with them at their private practices and provide mentorship and make sure that they're doing the right thing. And then I also got to run the quality assurance team as well at CHEPS, whereby, would also go to all the other DOH facilities where we had trained nurses, clinical associates, doctors, just to follow up and make sure that they're doing the right thing. And then I also was set on the board of assessing adverse events with the circumcision. So I did everything that was to be done with circumcision. I felt like I had exhausted that. And then in 2018, I resigned from CHEPS and joined Aqua as a clinical manager there. And Aqua also did VMMC quality assurance, and a huge portion of it was training. So I think I stayed for 3 months in Aqua because I felt like it was just a repetition of what CHEPS was doing. Whereas when I joined, it mainly talked about me doing training. But then I thought, I do not want to repeat the same thing that I did. Then I went and joined Aurum, and with Aurum, I was part of the QA team, VMMC QA team. But interestingly, the one portion that was very interesting for me was to run the Key Populations program as a project manager in Aurum. And I ran it for about a year, where I was overseeing, like I was a technical assistance of implementing partners there. So there were other organizations paid through Aurum by CBC that, was implementing. So me being a go-getter that I am, I thought, this is not good enough, I would really want to take charge of the program. And the program really focused at the time when I joined, the program focused on HIV prevention only. And, if you look at the cascades, you have to complete the cascades for us to reach the 95 UNAIDS goals. So I thought, no, we need to up our game with regards to this. And then in 2019, I established the pop-in clinics. They are in 5 districts in South Africa, 2 in Gauteng, 2 in KZN, and 1 in Nelspruit. So basically, it was still the same key populations program, but then I thought, for us to be able to complete the cascade, we'll have a prevention HIV prevention cascade and have a treatment cascade as well, and so would follow an individual. So then that's when I actually in 2018-19 I actually saw that. I discovered that my passion, or I would rather, specialize or stay in the HIV field. I grow fond of it as I grew to understand, the targets, and as I grew to understand the treatment cascades and different cascades. So then, from that, the program as pop-in clinics started providing prevention, HIV prevention care and treatment. So we would do PrEP, condoms, STIs, and then we'd test the patient, put them on treatment, follow them up until they're virally suppressed, and they live happily on ART. So that's what I currently am overseeing as well as a senior program manager at Aurum. And then, in 2019 as well, was it 2019? No, it was 2020 actually, where I enrolled for the honors program with Wits on emergency medicine. And that was really great, kept me on my toes as well. I enjoyed that a lot. Back to emergency medicine, before HIV, emergency medicine was my thing when I was still an undergrad student. And then I did the honors completed in 2021. I did a research study on men who have sex with men and transgender women that opt out of PrEP in Ekurhuleni. And the study was presented at the Vets Biennial Research Day. It was also presented at several conferences that I attended. I still haven't published yet. Yeah, that is taking a bit longer than I anticipated. I think I have too much on my plate. And currently, I am busy with the Masters in Public Health with the University of Johannesburg, and I am also a core principal investigator with Aurum Research. Quite a lot of other researchers that we are looking at. I think one of them that I have here is the evaluation, acceptability, and feasibility of e-PrEP model in South Africa. And at this study, we're looking at people accessing PrEP using a mobile app, like you would when you order on Takealot. So we want to take a lot PrEP in simple terms. So we're trying to move with innovations and move with, the technology that's there now. I mean, I should mention while I'm, before I actually forget, that in my undergrad years, I did my emergency rotation in Germiston Hospital. And while I was there, I remember Dr. Sole, who was the superintendent, the clinical superintendent at the time in 2013, call me, and I had just done my day, and then I went home. I stayed around Germiston at the time, and then he calls me. He says, listen, City, one of our doctors, Dr. Mganga, cannot make their call. So they're supposed to be on call from 4 o'clock on that day. And he says to me, do you mind coming in and filling up for her? I was like, oh, okay. That is awkward. But then I agreed because remember also I was a student and I wanted to also put my mark as a clinical associate. I mean, if I can come in and step in for a doctor and fulfill the duties, that means the superintendent has seen something in clinical associate that is very equivalent to a medical doctor. So I worked with another medical doctor, obviously, because we worked under supervision, but I absolutely did everything that the on-call doctor would have done. And, this is just, I'm telling this story and I always tell it because you just need to believe in yourself. You just need to be confident about who you are. And, your work has to speak for you. So also in the medical field, the work has to speak for you. So if you do things according to the book, follow guidelines and stuff, you can never go wrong. And you must always excel. So when you excel, you will always stand out. I mean, I stood out in Jamestown Hospital at the time. There were so many interns and there were so many other doctors that could have been called to fill that position. But I guess the way I presented myself, the way I carried myself as a clinical associate at that time said a lot. And at the time, I was so tiny and small, I didn't know how that guy got to that. So I just also want to mention the opportunities that I've seen, around the BCMP program. Obviously, the honors program, which is a great start up as well to put you in the postgrad community. So this just opens your doors. And I know of other colleagues that I when I was doing the honors program with them, they now working for ER consulting. They even started as undergrad, but I remember one of them had said, once you have the honors program, you become a senior in ER consulting, and there is so much trust because now you have specialized in this emergency medicine, and ER consulting is all about emergency medicine. So they trust you better, and also they supervise you. So with the scope of practice, that the supervision becomes more lenient with them depending on how many years have you qualified. So you can imagine, just in addition of the honors program, that you actually do get to be on top of the game. You are on top of your game. You are postgrad now. Basically, guys, you have a medical degree. You have to make use of it. So there are opportunities, a lot of opportunities in the NGO and private sectors. And private sectors, of course, I've mentioned ER consulting. I know of other hospitals that are hiring. I mean, Malverton Netcare is also hiring a lot of clinical associates. NGOs, I think NGOs was the first one to just be in the game and absorb a lot of clinical associates. I mean, I'm talking mostly about NGOs that are doing VMMCs, HIV, TB work, research work. They've also absorbed. And if you are more willing, I think once you start enrolling for a master's, a lot of these NGOs just want to collaborate with a lot of clinical associates. And then there is administrative roles and management roles as well, studying further, like I said already. As you know, we already have a Dr. Sanile Ngobo in as a clinical associate who's completed their PhD. There's a lot of salary growth. I mean, everybody wants to know that, am I just going to qualify and sit? And I mean, it just depends on, how much you want to put yourself out there. I can tell you now that nothing comes for free. You need to be dedicated. You need to be, to give your all. You need to read. You need to, know what is happening in the medical field. And you can't be a job hopper because you need to pick one and go with it. So if you pick to be in emergency medicine, you need to pick that and run with it and grow in it, because you cannot be a master of all. And then also I know a lot of our colleagues also that are working with private specialists. They're working in the OBGYN, they're working with the audiology sectors. They're working with a lot of orthopedic specialists as well. So there are a lot of opportunities out there. So just don't cut yourself short. Just in wrapping up, I think these for me have worked, and there's a lot of motivating messages that I use, I think, and I've used in the past years. Have a teachable spirit, as you aren't always right. But also having a teachable spirit does not mean you must dilute yourself, or you must, think little of yourself. Just be bold, be seen. Want to, I can tell you, when I say be bold, for me, I can attach it to one rotation that I did, an ICU rotation that I did with my honors program in Charlotte Maluleke. I mean, Charlotte Maluleke ICU, it's a tertiary or academic hospital. So in ICU there are no undergrads. In ICU there was the leader of the ICU. It's a professor. And then you see fellows, doctors that are doing their fellowship. And then you also see regs. So there is no medical officer there. There is no intern and stuff. And then there's us. And then, the questions that were asked there, I was like, "Phew, I've never even heard of this. I mean, this is deeper." And I went in and I read about it. And the following day, the prof just ignored me and did not ask me any question, because he had asked me the previous day and I didn't know. So obviously, I don't know how he thought. And then he started picking on, the regs and the fellows and blah. And then I raised my hand and I said, "Prof, listen, the question you asked me, yes, that I know it's answered, but I can elaborate further." And then I elaborated. And I can tell you, even on my rotation cut thing book tablet, they had written a nice comment on how I had completed and how I was bold and how I was confident, and not letting off, trying to allowing other people to make me feel like I do not belong. So in short, you belong everywhere. You have a medical degree, make use of it, and you owe it to yourself to begin the journey. So you already started. So once you qualify, make sure that you find what you're passionate about and move with it. Thank you, guys. Thank you as well for being invited. I know this is the third webinar, and it's also my third appearance on it. So I appreciate and I love working with you guys. Thank you so much.
Thank you so much, Tshidi. Thank you so much. You managed to summarize 10 years worth of work in 15 minutes. But thank you so much, and congratulations on all the things that you are doing. We wish you lots and lots of more growth in the future. Ronewa is our next speaker.
Hi, everyone. My name is Ronella Razuma, as she has said. And Ronella is a girl from Quro, a small village in Thohoyandou, Venda. So I was born there. I am 24 years old. I went to school there in Venda, and I basically completed both my primary education and high school education that side until I found my way to Wits in 2017, wherein I bumped into BCMP, literally. And then while I was studying BCMP, I got to love or fall in love with the profession of clinical associate. And while I was there, I also had an opportunity to go on the Wits and TAF exchange program. I'm just trying to rush through everything for the interest of time. I got to go on an exchange program in Boston with Wits University and Tufts. And there I got an opportunity to see the profession of clinical associates from the view of physician assistants. And it was very interesting to see what clinical associates are able to do or what they can be, which I feel or I felt that at that time was something that was not really portrayed in the South African context. So I then went there in 2019 had that opportunity while I was in my third year. And I knew from that moment that I wanted to be in a space that would allow me to be innovative, that would be influential towards the profession of clinical associates, where I would be able to make an impact or a change, or be able to show people what we can be, or how versatile we can be. So then, due to interest and other things, I found myself also then joining, studying LLB law with UNISA part-time. So I then started in 2021. And it has been a slow journey since then, because I am working full-time, I am a wife full-time, a mom full-time. So yeah, it has been a slow journey, but then I have been pushing that side, and that is all in the aspect of my studies. And then in terms of my professional career, immediately when I graduated in 2019, because I knew that I wanted to be in a private space wherein I wanted to be influential, I then started applying for private companies. And then when the woe fell upon us of COVID-19, I then had an opportunity to join a company called Quro, and that is where I started working March 2020. Yeah, then we'll move on to the next slide. Just for me to go on into detail as to what Quro is. So Quro is a technology-enabled hospital at home company. So we basically provide care for our patients from the comfort of their homes. And we call that hospital at home. As it's defined as a service that provides active treatment by the healthcare professional in the patient's home of a condition that would otherwise require acute hospital inpatient care. And I am stressing the word acute hospital inpatient care, because that is very important, because all our patients that we treat are patients that are basically stable enough to be at home, but would have rather been admitted for the acute treatment. And it's always for a limited period of time. So we're not looking at patients that have chronic conditions that would rather need an extended treatment, or an extended period of time for them to be treated. Basically, Quro saw the need to approach healthcare in a different way, right? So what it does is that it combines in-hospital care together with virtual visits, with remote patient monitoring. So it then offers patients timely hospital-level care in their homes. And this is a viable option to the physical or the brick-and-mortar hospital, right, that a patient would rather have, because it's something that is cheaper, because patients are usually paying for the bed, the food that they are eating at the hospital. So when we provide this care for them, what they do is that they only pay the services from the healthcare workers themselves, and then they are in the comfort of their home, they're eating their own food. And also, we do this through the remote patient monitoring and predictive analytics that we do. So we leverage technology, we use biosensors that tell us the patient's vitals, so your heart rate, your breathing rate, your SATs, all the vitals that we can get from a patient, blood pressure, HGTs, we get those remotely, right? And I'll just show you how that is in future slides. So the patient then gets 24-hour monitoring, and that all is done mostly by clinical associates. So what Quro has done is that they have seen clinical associates being underutilized in the healthcare field in South Africa, and they wanted to make use of this professions, these individuals that are very brilliant. And I just happened to be part of the first cohorts of clinical associates to be taken into the company. And that is such a great privilege and a great opportunity for me, because then it also gave me an opportunity to shape the way that I wanted to be viewed as a clinical associate within the company. So clinical associates are the ones that are mostly providing the remote patient monitoring. We are the ones that are doing the predictive analytics there. So we are basically able to spot a patient that is gonna have a possible MI in like 2 hours earlier before they do that. So that requires a lot of skills from us. So you need to be able to interpret all your vitals and be able to visualize how your patient looks like. So you're doing this in front of your screen, you need to be able to visualize. So if this patient's heart rate is like this, if this patient's respiratory rate is like this, if this patient's ECG is like this, what is exactly happening with the patient on the other side? And then from there, if there's any emergency that is happening, we're able to activate emergency. So what we do is that we don't do this by ourselves. We are supported by RNs, we are supported by doctors. Doctors are there to provide clinical oversight. They are there to provide clinical oversight. So they are there to help us. You're not, I'm not all by myself. So there's always someone who is there to assist whenever there is any challenge, just as the clinical associate profession is a supervised practice. However, the clinical associate's role or my role in this regard for me to provide the real-time vital signs monitoring. I stay in a 24-hour command center. I give in-person visits and also virtual visits. So there are times where I have to go and visit the patient at their house. And this could be for me to provide medication for the patient, or me to clinically assess the patient, because sometimes the vitals are just not enough. You also want to have more objective data. So we then go in to provide clinical assessments, to give IV therapies at their houses and other medication, also to give short-term oxygen, to take bloods, and things like that, to also provide things like wound care and other things that the patient might need. So also we are responsible for activation of emergency protocol, like I mentioned earlier. So it means that should the patient be experiencing any emergency, the clinical associates are the ones that activate emergency protocol. So then the ambulance would then go and see the patient. So basically, we are kind of like the pillars that hold the company, because we are the ones that are actively managing these patients with the assistance of the doctors and the nurses, where the nurses will be doing then the IV administration at times, and also the doctors that are there to also advise on the treatment of the patient. Is a picture basically of the biocenter that we use to capture vitals of the patient. As you can see, it basically has 2 points that sticks on the patient, and that helps us to have kind of like a 2-lead ECG picture of the patient. We ones that interpret heart rate, and then we also get sets from an integrated sets monitor, respiratory rate, the posture of the patient, activity of the patient, and it's wireless. And it sends real-time data. So data is captured every minute, just to give you a picture of what we do. So this is a picture of basically how a day in the command center looks like. That is me. And when you look at the monitor, you can see there's like multiple files of patients that also has like data streaming. So that's live data streaming, heart rate, breathing rate, steps coming through, temperature coming through of the patient. And basically that's all you're sitting and doing, and also doing the virtual consultations over the phone. Just to conclude my talk, there's been a lot that I feel that we have achieved as clinical associates at large. My personal achievements in the 3 years that I've been at Quro Medical is one, being able to advocate for clinical associates. Where we are sitting right now, I think we have about 9 clinical associates. We started out at 4, and we have been able to come up with a structure from several conversations that we've had with the bosses, come up with a structure for us to be able to see how we can grow as clinical associates within the company. So right now we are working on a structure wherein from the point of clinical associate, where then do you go? So there is something that I can't really share on right now, but there's like levels of clinical associates that we have come up with. And this even goes to a clinical associate becoming the medical director within the company. So I'm very, very proud of the fact that I've been able to kind of reflect what I have learned from Boston or from the States, wherein I was able to see how the clinical associate profession is a versatile profession. And I was able to kind of teach the people within my company that we are more than just what we see, and we can do better. We can be in leadership roles, and we can be able to also change the healthcare system at large, right? So yeah, currently I am the most senior clinical team member within the Quro Medical Company, and I am able to now train new people that come through into the company in the hospital at home offering, interpreting the data, being able to give the predictive analysis, how to onboard patients onto our care, things like that. So those are just some of the achievements that I've had. And also I've been able to take part in coming up with several clinical protocols and standard operations of procedures that have been able to carry the company thus far. However, like any other thing, there has been challenges that I have come across. I mean, being the first cohort of clinical associates that came into the company, there was a lot that we needed there's the culture that we needed to set, and also the advocating of the clinical associates didn't really come easy, because as much as Quro knew of who clinical associates are, I felt that over and over again, we needed to prove what we can do, right? So yeah, we needed to set a certain precedence for everyone that is coming through. And being a recent graduate, it was kind of difficult because I really didn't have any experience in terms of what we can do or how we can present ourselves. And that's led to a lot of mistakes that we have learned ourselves as the clinical associates within the company, and also the management at large. And also the other thing is that over time, I've seen kind of like my clinical skills coming to a deterioration in a way. I mean, the last time I did an LP was when I was in third year. So there are things like that. However, in order to kind of like bridge that gap, we still do courses, short courses, just to make sure that we are still up to date, just in case I need to do something. We still make sure that our BLSs and things like that are up to date, because the main things that we kind of like focus on, or the main skills that are needed for you to be able to be a clinical associate in this type of environments, is things like emergency medicine, your internal medicine. So that would include cardiology, pulmonology, nephrology, things like that. Those are the types of patients that you have, because you are having your end-stage renal failure patients, you're having your CCF patients, you are having your patients with pneumonia, you are having your patients with asthmas, you're having your patients that have UTIs and you're supposed to treat. So yeah, those are some of the things that I've noted. Some skills do deteriorate over time. And also there's always something new to learn. You never really have it all figured out. I'm currently on leave as we speak, and I know that when I go back to work in 2 weeks, I am going to feel like I'm new again. And so that's what's interesting. I think that's what always keeps me moving, because there's always something new to grasp. There's always new technology. Like when I get there, Insight or the dashboard that you saw, they might not look doesn't look the way that it looked. It doesn't look the way that it looked on the picture there right now as I speak. So when I get there, it might just be something totally different. So that's always something interesting. And as Tshidi has said, you just need to be always willing to learn. And that's how you kind of like overcome challenges like that. And also just being able to prove what I am able to do has just been one of the greatest challenges. However, I am so grateful that I have people that are willing to develop clinical associates, and I am so excited to see where the company at large is heading to, and also myself as a professional. And I think the last thing that I can just say as a form of motivation is nothing that you don't know. It's that study, because you're going to need that knowledge when you get to the professional space. That book is not just there for you to just, look at it. You're going to need that knowledge, and it's going to be a lot for you to now start thinking about studying when you're already having to do what you need to do. And two, you need to stay motivated. No matter what, it can be tough out there in terms of finding yourself, because we are still trying to build the profession in itself. So when you do find your niche, just always stay motivated. There is opportunities everywhere. And if you're not seeing opportunities, create opportunities. I mean, where I am right now, I don't think that I would have been able to climb a ladder if I didn't advocate for the fact that there should be a ladder somewhere. I wouldn't be a senior clinical associate. I would just be a clinical associate if I didn't advocate and create opportunities for myself. So if opportunities are not there, create the opportunity yourself. Fight your way through. And yeah, thank you so much. I think.
Thank you, Ronewa. Thank you for those beautiful words. Create opportunities for yourselves. Okay, so we are going to move on to our last speaker for this evening, Ms. Goodness Maluleke. Goodness, are you online, ready to present?
I am online. Good evening to everybody. I'd like to start the evening by thanking you for steering the ship for us. And I'd like to acknowledge my two other speakers. They came before me in sharing their journey as clinical associates. Amazing, amazing, beautiful women, as mentioned before. Good evening to everybody who has joined into the webinar. My name is Goodness H. Maluleka. I'm going to be talking a little bit about myself. We're going to start all the way back where it started. Um, so, I am Goodness, like I said, and I go by another name that some others might know me by, called Lanipa, meaning respect. I was born and bred in Hammanskraal, a little rural town outside of Pretoria. Well, still falls under Pretoria. I was born into a medical family, raised by a single parent. My mother, who is currently a retired professional nurse, just to give background. And I have one other sibling who is my brother, who's also in the medical field as a medical officer. I believe we can all conclude that the whole career came from my mother. I was first introduced into the profession of being a clinical associate during a confused stage. But before I get there, let me just go back. I commenced my schooling at Babaleki Foundation phase, moved to two other schools, and completed my high school career in Christian Progressive College in 2013. 2014, then I decided to take a gap year to figure out things. And 2015, I was then accepted into the Bachelor's of Clinical Medical Practice at the University of Pretoria, which I then completed in 2017. My professional career started in a pharmaceutical research industry, working as a clinical study coordinator in clinical trials. I then moved into private practice. I was during the time I was in the pharmaceutical research time industry. It was an amazing time. We were working with upcoming medication. One of the studies that I was doing was actually looking into how omega-3 could be a great drug in reducing cholesterol. Patients that have the three triad chronic conditions, which is hypertension, sugar diabetes, and hypercholesteremia. And one of the great things that happened within that time that I was within the research industry is that we found that omega-3 can actually help also with weight loss, but high doses, I'm sure if you look into it, you can find published research. Then moved into private practice, worked in Medicare 24, that was in Boksburg. And sadly, during the time, started there during 2018 as a locum basis. Then I was then adapted as a permanent staff at Medicare 24. Sadly, when the pandemic started, I then felt the need to contribute a bit more, having seen how it changed everybody's lives. I left the private practice to join the fight against the pandemic by joining the public sector. Worked at Dr. Yusuf Dadu Hospital in 2021 under the COVID contract at the time. And yeah, it was a life-changing experience for one. Um, and then soon after, I had um, one of my prior facilitators that when I was a student, I worked in Tembisa Tertiary Hospital, and one of my facilitators, Dr. Ngoi, just called me and said, hey, I'm looking for a brilliant clinical associate, and Mamelodi, I think would be a best fit for you. So applied to Mamelodi, and from late 2021, yes, late 2021, late 2021, I then switched to go to Mamelodi Regional Hospital, and I've been working in the emergency department until current. My role at work, I'm placed in a department filled with awesome seniors that treat me and respect me as a fellow colleague. In the emergency unit, many might be intimidated by it, but believe me, it is a place where you learn most and best. It requires you to be sharp at all times. You need to be fast and decisive when making decisions and saving a life. Always equip yourself with knowledge, because that is what you will stand by at all times. Read, practice, and never be afraid to ask if you're not sure about something. It takes a team, always. Remember that it takes a team. You're never an individual in any department that you work in. In my department, I get assigned to triage patients coming into the hospital. I see patients in the pediatric casualty, trauma patients, all medical emergencies, and I assist in resuscitations of patients. Some of the things I can tell you in terms of facing challenges is that please always remain resilient and kind. There will always be a patient or colleague that makes you doubt yourself, whether being a difficult case that you run yourself into, or there's a senior on the floor that makes you feel inadequate because you're a clinical associate. Many in your careers, starting or within your careers, I'm sure you have had that one colleague that made you feel a little bit smaller than you actually are, but always stay resilient. Your backbone is your knowledge. Remember that. Equip yourself with the right knowledge so that you're confident in all you do when treating a patient. You are not expected to know everything, remember that. So always ask a senior working with you. My achievements that I've achieved during this time, I am currently doing my postgrad diploma in public health with the university, having interest in epidemiology and biostatistics, actually. That all fueled by the pandemic, wanting to get knowledge and understand what was happening and how all that we were being told was being said, how they came to those conclusions, and all that. Also, I am a Golden Key honorary member, and the University of Pretoria, and together with my senior HODs, have entrusted me to train and mentor BCMP students from all years, year 1 to 3, and also with medical interns that work with us. The last wording that I would like to leave everybody who's listening here, as brief as I needed this to be, um, always remember you are divinely guided and you are moving in alignment with your soul's purpose, one patient at a time. Thank you, everybody, for coming in and listening to me.
Wow, goodness, that was so profound. Thank you for sharing. Those last words were really, really profound. They hit home for most of us, I'm sure, especially the ones practicing as clinicians. Um, what just stood out from me from what Goodness was saying is how important it is for us to create great first impressions. and good impressions with the other cadres that we work with. Goodness and Tshidi have mentioned how they both had preceptors call them back to say, hey, listen, I see this opportunity and I know you would fit in perfectly. So that's a little nugget that I encourage the students to take home tonight. You never know who will be sitting across from you, interviewing you. It could be your preceptor. So always try when you are in the clinical space to put your best foot forward. So we've been raving about all these beautiful ladies that presented for us today. So I'm going to ask for the beautiful ladies to please put their cameras on as we tackle a couple of questions. Okay, so I will kick off the questions with a question for each of the speakers. Ngobeko, your hand is noted. So my first question is for Tidimalo Chavani. So you mentioned during your presentation how you worked in 4 different provinces. And I just wanted to know, working in all these different provinces, did you notice a difference of how clinical associates were integrated in each province, or were we working the same in all? My next question is then for Ronella, to say how many clinical associates are actually in Quro Medical right now? Is there space for growth? Are they hiring more clinical associates? And is Quro Medical nationwide or only in the big metros? My last question is then for Goodness, wanting to know if you've seen a difference, Goodness, having worked in public and private sector. Have you seen a difference? And if you have, what is it in how clinical associates are integrated into both sectors? I'll give it over to our speakers. Tshidi?
Thank you, Mpumi. Thank you for the question. So when I started working, and to date, I'm working with quite a few clinical associates. And when I started working as a project manager in the 3 different provinces with clinical associates, I mean, there were surgeons, primarily who were hired as surgeons, and depending on your abilities and depending on your interest, then you'll be afforded other responsibilities. So I was working with clinical associates as surgeons. I worked with them as quality assurance managers. I worked with them as site managers. I worked with clinical associates that became team leads, and I think I worked with Ngubeko at some point. So there would be a surgeon / site manager as well. So it was just dependent on what other abilities do you have and what are you showing management. Remember, we can only appoint you much more responsibilities, and that is more only dependent on you as an individual, on where are your strengths and what are your interests. And even if something is not of strength to you, are you willing to take it on as a challenge? I mean, to date, I am working with clinical associates who are project managers, clinical associates who are site leads. They're running clinics as site managers. I mean, they have a lot. I mean, and in my experience in the 10 years that I've been in the field, I've conducted a lot of interviews on clinical associates, and I can tell you it is just an individual who would then come in and say, I want to challenge myself. And then there are other individuals that are just there and say, I think also we are different as people. And as said also with the previous 2 speakers, what I heard from them is that you need to push beyond the boundaries that are set for clinical associates. So that means breaking down doors and breaking down walls that are keeping us to stay within these boundaries.
Thank you, Tshidi. Ronella, the next question was for you.
So currently we have about 9 clinical associates that are working at Quro Medical. And there is room for growth. I think in the next month or 2, we should be growing to about 15 of those clinical associates. And Quro is currently in and around Gauteng right now. So our headquarters or the main command center is in Bryanston. And then we cater for patients around Pretoria, Johannesburg, as far as the south of Johannesburg. And we also have Quro, Bloemfontein. We also have Quro, pardon me if I'm not pronouncing this right. So we have Quro, Gqeberha, yes. And we are currently working on going international. So in the next few weeks, we will be announcing Quro Medical in a neighboring country. So yeah, there is potential for growth, not only for Quro itself, but also for clinical associates within the company. Hence, I mentioned the development of a structure or a leadership ladder that Quro is developing.
Nice, nice. Before you go, Ronella, we have a question from Vulenda who wants to know if you can give us a salary range for the clinical associates at Quro Medical, maybe entry level.
All right. Hi, Vulenda. So salaries are based on the experience that the person has and also the knowledge that you're coming in with in the company. So my entry level salary is not the same as other people, but if I do remember correctly, when I started in, my entry level was 21K, if I'm not mistaken.
Thank you, Ronella. Goodness.
My question was the difference between the public and the private sector. In reference to research, research is an industry of its own compared to what you are trained in school to do. Most of the times when you see patients, it's by schedule. You already have like a schedule done that you see patients by. There's a guideline as to procedures that you need to do, or clinical management that you do with a patient that is on a study. And in terms of my other private at Medicare 24, it was a private clinic. So most of the times it was like a GP, anybody that practices in a GP. You saw certain conditions. There are days that you will have that one patient that comes in with ST elevations and you just need to know what to do rapidly. But I would say the difference between private and public that I've noted is that in terms of your skills and exposure, public has been most favorable. I've been more exposed working in the COVID contract, working in the emergency department. You get to apply your mind more than what I can say in private care, because not everybody can afford private care. So certain diseases or illnesses you will not necessarily be exposed to in terms of management. So yeah, public in terms of expanding your skills and knowledge has been more favorable in my case. I hope that answers the question.
In the interest of time, guys, I'm just going to give our speakers 30 seconds each just to wrap up and tell us where do they see the profession of clinical associates. Are they seeing us grow? And if so, how and where do they see us going in South Africa? 30 minutes each, ladies, and then we will close.
Yeah, let me try and tackle it. Thank you, Mpumi. So for me, I think in the past 10 years, we've seen the struggles we've been through. I think we've advocated for clinical associates in the different spaces. When I'm talking about just the people that have been practicing in the past 10 years. And I think even though the advocacy hasn't really been like a national type of advocacy, everybody has done their part where they are based or where they'd be seen. So I'd make an example with doing an honors degree and being, in the different hospitals. Everybody just assumes that you're a medical doctor, but we've always advocated and we've always worn a clinical associate badge with high pride, and we've always excelled. So for me, I see the clinical associate profession growing, and it will still need a lot of advocacy. Unfortunately, we do lose some along the way, but I would really encourage those of us that are still with the profession, to keep pushing. Let's just open doors for each other as well. I think that's also one of the most important things, that when you get into a field, just ensure that, you open doors. I mean, if it's just one of you there, you may not be seen so much, but if there is more than one and we are all striving for excellence, I think slowly but surely this profession will grow and will be known. And the next time we tackle it with the Department of Health and the Ministers of Health in the coming future, they, one of them will hear us, and we would have a lot of data to show what have we done in the past. Thank you. Over.
I think I would have to agree with Matsidi. So there is definitely a future within the clinical associate profession. There is room for major growth. However, that growth does come from us as individuals. And yes, it can be very tiring to keep on advocating. I mean, as she has mentioned, over the past 10 years, there have been people advocating, and I really feel like whenever we do enter into the space, it's also up to us to just take our part and continue advocating, and also to just show the diversity of the profession, because I think at this point, it all lies on us. We make who clinical associates are, from how we present ourselves, from how we explain who we are, or how we behave towards patients and towards other professions. And it's okay to feel like you don't know where you are going or what is happening. We all do figure ourselves out, or we do figure out where we are going eventually.
I believe both speakers have said most of what I also wanted to say, but I would say that as a clinical associate, whatever space that you enter in, leave your mark there. Make sure that you are remembered as the clinical associate that made a difference. We still have a long way to go with the challenges that we have faced at the moment, but there is potential for this profession to grow in many industries, as you've all seen by my previous other co-speakers here, that they're in different industries, and there's many other industries that we can penetrate into. Just make sure that wherever you go, that you are remembered. Our profession is remembered as people that contribute to our health systems, that contribute to our communities. But yeah, in my belief is that we've got a long way to go, and many opportunities to explore as we educate people about who we are and show them what we can do.
Thank you. Before I say my goodbyes, Mr. Emmanuel, who is currently the coordinator for the honors program, emergency honors program under the leadership of Ms. Aviwe, is calling upon everyone who is interested in partaking in this postgraduate degree honors that was created specifically for us clinical associates. So he's left his details in the chat space. If you're interested, if you want to find out more on how to apply, how to get involved, get in touch with him His details are in the chat space. Thank you so much, guys. I know we've gone over time by 20 minutes and you're all still here. So thank you so much for your patience. Thank you so much for showing up. Thank you so much for, participating, for continuing to advocate for clinical associates in your own little space. And if I can sum up this evening's takeaway for me is we must create the opportunities for ourselves. We are the ones that we have been waiting for. We have arrived, and let us make everyone see that. Thank you, everybody. Have a beautiful, beautiful evening. Catch this series and all the others that have been recorded on our YouTube channel. So go on to YouTube, Instagram, follow us on all the social media platforms to find out more. So see you guys in May. Thank you and bye-bye.